Hi, my name is Kent Kingsley. I'm part owner with My Medigap Consultant. We're an independent health insurance brokerage specializing in the senior market. Today, we're going to go over the two most common Medicare supplement plans and determine why you are probably paying too much. Let me explain. If you're currently watching this and you are already enrolled in Medicare and on a Medicare Plan F, or you're just now aging into Medicare and all your friends are on Plan F and they tell you that you must get Plan F. It's the best thing out there. Well, here we're going to show you that that probably is not the wisest decision. So let's dive down into these two different options and take a look at them and see what really is best for you. All right, so first we're going to go over Medicare supplements. Just a quick overview of the different supplemental plans that are available. Now, Medicare supplements are also referred to as Medigap plans. So most of the presentation, I will be referring to them as Medigap. As you see at the very top, Medigap plans are identified as letters A through N. And on the left-hand side, you will see all the different what we call the gaps of Medicare. These are parts of a highlight of Medicare and what it covers. And then in the center here, you will see how the different plans cover those gaps. The two that we're going to focus on today are letters F and G. These are the two most common Medigap plans that people purchase. Most people will probably be on Plan F for various reasons. So with that said, let's jump right over and look a little bit further into the different parts of a supplement. Medicare supplements, when you're on a Medicare supplement, you still have your original Medicare. Original Medicare is referred to as your Part A and B. With a Medicare supplement, it's very easy to budget your medical expenses because you know exactly what your costs are going to be. We'll get into that a little bit more as we go on in the presentation. With Medicare supplements, you have no networks. Your network is Medicare. So if your doctor accepts Medicare, they will accept your Medicare supplement regardless of who the carrier is with. Because you have original Medicare with a Medicare supplement, you do not have prescription drug coverage with this. So you must buy what's a separate Part D plan. This is your prescription drug coverage. Medicare supplements are also guaranteed renewable, so the carrier can never cancel your coverage. You can change plans at any time with a Medicare supplement. However, you do have to go through underwriting if you are outside of your initial election window, which would be 6 months after turning age 65 or 6 months after enrolling in your Part B plan. Benefits with a Medicare supplement stay the same each year. All plans are standardized. So we're going to get into that here in this next slide. So it's a very important part of Medicare supplements. What is standardization? First, let's take a look at the popular Choosing a Medigap Policy booklet that's put out by the Centers for Medicare and Medicaid Services each year. On page 9 in this book, it says each standardized Medigap policy must offer the same basic benefits, no matter which insurance company sells it. Cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. That's just straight to the point on page 9. So what that's saying is that Plan F with carrier ABC is the exact same as Plan F with carrier XYZ. There is no difference because all plans have to cover the exact same benefits. Okay, so that's very important when you're looking at plans and prices. We like to think of this as it's like 2 boxes of Cheerios. You know, if I go to Walmart and I pick up a box of Cheerios, and then my wife goes to Harris Teeter and picks up a box of Cheerios. When we both get home, we both have 2 boxes of Cheerios. Same size, same everything. However, when we look at the receipt, I paid $2.55 for my box of Cheerios, whereas she paid $3.95 for her box of Cheerios. Tastes the same, looks the same, it is the same. However, I got the better deal. Same thing with standardization. comparing plans F from one carrier to another carrier, or plan G from one carrier to another carrier. Here I'm going to show you some things why we do not recommend plan F and why your friends are probably paying more than you will if you follow our guide. Plan F is the most comprehensive plan that's out there. If you recall from that second slide that we looked at, Plan F covers 100% of what Medicare does not cover, as long as it's Medicare approved. But it is not the best overall value, and we're going to show you that. Usage is usually higher due to first dollar coverage on Plan F. Again, it covers 100%. So there's no cost sharing with the consumer. The insurance company picks up everything. So you're going to have a much higher usage on Plan F, which in turn causes rates to increase higher over time. That's one of the reasons why Plan F tends to trend on a higher rate. When they do have rate increases, they tend to be higher than other plans, especially with Plan G. Plan F is also going to go away in the year 2020. Now, if you're on a Plan F and you can't change Plan F come 2020, your plan's not going to go away. You'll be able to keep it. You'll be able to stay on that plan because it will be grandfathered in. However, they will not be selling Plan F anymore as of 2020. Plan F is also a guaranteed issue plan in certain situations. A certain situation would be, let's say you were on a group retiree health plan and that company decided to no longer offer all their group retirees health benefits anymore. Therefore, you're losing your group coverage. Therefore, you're going to be in a guaranteed issue situation. And you can purchase Medicare Supplement plans A, C, or F. Most people are going to choose F because Plan F covers 100% of what Medicare does not. So you have a much higher risk pool in that guaranteed issue situation. Some of those people coming off their group plans might have some, cancer, heart attack, stroke, much unhealthier risk pool. All right, so now let's make the case for Plan G. As we showed you earlier on the chart, now I've condensed this chart down to just show plans F and G. And as you see, under Plan F, it covers 100% of what Medicare does not, whereas Plan G covers 100% where Medicare does not, with the exception of that Part B deductible. Now, that Part B deductible for 2016 is $166. So typically, Plan F is going to cost about $300 more, $300 or more in premiums than Plan G will. So why would you pay another $300 in premiums just so that the insurance company can pay for the $166 deductible? It makes no sense. And hopefully you see that. So again, here you're going to save $300 or more in premiums, but you're going to send out the $166 in the Part B deductible to your doctor. So again, let's take a look at a couple different case scenarios, and these are actual clients of ours. First one came to us, a 65-year-old female non-smoker living here in Charlotte, where I am, and she came to us wanting Plan F. She was convinced Plan F was the way to go. Actually, she was looking at a plan with another carrier that was much higher than the one I'm showing here, about $40 more, roughly $150. And I showed her, I was like, well, look, at least if you want to go with Plan F, if you insist on Plan F, Aetna's got the lowest rates for the highest rated carrier in North Carolina right now for their Plan F at $117.62. So I'd convinced her that Plan F with Aetna was better than the one she was going with because, again, she's going to save $40 more for the exact same plan. Now, getting into the presentation with her a little bit more, showed her the benefits of Plan G and why she should go with Plan G. So when we pulled up the rates for Plan G, Mutual of Omaha's Plan G, and she happens to qualify for a household discount, which got her rate down with Mutual of Omaha to $83.64. Okay, so that comes out to almost a $34 per month savings over a Plan F. That's an annual premium savings of $407.76. Let's say she does meet her full Part B deductible for the year of $166 during the course of the year. She still, in a worst case scenario, saves $241.76. Now, a best case scenario, she's going to save $407.76. But chances are she's going to have a doctor visit here and there that's going to eat into that $166 deductible. So at the very least, we saved her $241.76. Now, this is a lady that was turning 65. You're watching this presentation, most likely you're already on a Medicare supplement plan. And so for that case, let's go over this example of this 72-year-old, again, another female. She was out of the Raleigh area, and she came to us, and she was on a ARP plan since she turned 65. She's been on this plan for 7 years. AARP is a great company, but they don't have the best rates. But that's the plan that she knew. That's what her friends had. Now she's up to paying $192.46 for her Plan F. She's in great health, never uses the plan. And so we showed her Mutual of Omaha again in this case because she qualifies for a household discount. And she was able to qualify for Mutual of Omaha's Plan G for $97.98. This gave her a monthly savings of $94.48. That, folks, is $1,133.76 in annual premium savings. That is substantial. Again, she's responsible now for that Part B deductible of $166. So now for her, best case scenario, or worst case scenario, I should say, is she will save $967.76 in annual premiums. That's at the very least she will save $967. That is why Plan G is better, as long as you can qualify for it. So again, let's look at the benefits of Plan G again versus Plan F. Plan F, as we mentioned earlier, tends to have a less healthy pool of people due to its guaranteed issue feature and its lazy agent sales factor. Again, we call the lazy agent sales factor is a lot of times new Medicare supplement agents might only work for a particular company and all they offer is Plan F, or that's all they can offer is that one particular carrier. They're going to show Plan F and just say, hey, it covers 100%, you don't have to worry about anything. Plan G is not a guaranteed issue. So again, the only time that someone can get on Plan G with no health questions is when they first enroll in Medicare Part B. You tend to have a healthier pool of people in Plan G. Again, it's not a guaranteed issue plan. You do have to go through underwriting, so you have to answer health questions if you're changing to that plan later in life. So you tend to have a healthier pool of people in Plan G, which keeps the rates more stable over the years. And again, in summary, remember, Plan G plus the annual Part B deductible, which in 2016 is $166, equals Plan F. So, how much can you save? Again, rates vary by location. They also vary by household. So each person's going to be different. So we just request that you contact us to see how much your particular case we can save you. You can do that by calling us at 888-729-9364 or visit our website directly at www.ychooseplang.com and scroll down to the bottom of the page and just fill out the contact form. We're happy to help make sense of it all to you. Now I know changing plans, a lot of people say my plan's been great, covers everything. I don't want to change plans, and it gets a lot of people worried. So some of the frequently asked questions is will it cover all my claims? Yes, all claims are covered the exact same regardless of the carrier. So Plan G with one carrier will cover the same as Plan G with another carrier, or Plan F versus Plan F. They will all cover your claims exactly the same. Everything is standardized. Will it pay as good as my current Med Sup plan? Again, Yes, they are all standardized, so there's no difference between one plan versus the next. Is there a cost for my services? Absolutely not. We are an independent brokerage. We can shop your plans with all the different carriers. Your cost is the same using me as it is if you go to the carrier directly. Why should I work with someone over the phone? Well, we do everything over the phone and the internet. You don't have to get cleaned up for us. We're not coming to your house. You don't have to offer us coffee or tea. We'll do everything over the phone and via a screen share. We put you on our computer with us so you can see exactly what we're looking at. We'll do the application with you right over the computer, just as if we were sitting across the table from you. Very simple, non-threatening environment for both of us. Will you be able to see your current doctor? Absolutely. Again, as we stated earlier, there are no networks. So if your doctor accepts Medicare, they will accept your supplement. If you were going to them with AARP and now you're looking at changing to another carrier, they will still take that other carrier. There is no network. Will your rate change each year? As you know, if you've been on a Medicare supplement plan, rates do tend to go up every year, regardless of the carrier. It's just how much are they going to go up from carrier to carrier. Each year is going to be different. We try to minimize that effect by, again, choosing a stable company that offers good rates and has been in the market for many years, and therefore they've got some stability built into their rates. So that, again, working with a broker like ourselves will help you in that selection. Again, our service is free to use. There's no cost to use our services. We review your Medigap plans and help you enroll. We will review this as you tend to get rate increases over the years. We also help you understand your Part D selection. That's a very important part and a big money saver for a lot of people when if you do not choose the proper Part D drug plan. We help you understand those options and help you with that selection. And we annual reviews of your plans. As brokers, we work for you, not the companies, and we do specialize in the senior market. We make the complicated easy to understand. Hopefully, you will find this all very simple process, and you don't have to spend hours trying to decipher through which plan is going to be best for you, because let's face it, you have better things to do with your time. Enjoy your retirement. Don't worry about which Medicare plan you should choose next. Again, what's the next step? Simply give us a call, 888-729-9364. You can also reach us via email at info@mymedigapconsultant.com or visit us at our website, www.whychooseplang.com. My name is Kent Kingsley. I'll be happy to help you, as well as Rusty Williams. One of the two of us will get back to you.